what are these types of cancers that we get to hear about?
Of course, cervical cancer is the most common. Cervical and breast cancer.
And, yeah,
very common in women. So there's the breast cancer, cervical cancer. Each part of the reproductive organ can develop cancer. You can have cancer of the skin, in the labia. The birth canal itself, the vagina, you can have vaginal cancer. Then, of course, the cervix. Then once you get in, the womb, that womb of the uterus, the inner part, you've mentioned it, is called the endometrium. So you can have endometrial cancer. Then the next layer on the womb is the muscle part of it. The one that usually you get cramps during menses. You can have cancer of that muscle. Yes, we call that leiomyosarcoma. But that one usually is on the age groups 50 and above. But sometimes it can happen even in the lower age group. We have the fallopian tube, very rare, but it can happen. And ovarian cancer, it's quite common. But also the age group after 45, there's a type of ovarian cancer that is common in that age group. But there are also cancers for the young, even teenagers, and mostly ovarian cancer. We have a type of ovarian cancer that are common teenagers, maybe around 20s. And sometimes people wonder what happened that a young girl is having cancer. So cancer, you can get cancer of any part of the reproductive system.
And how do I rule out that? Okay, you know, most of the time we love, being African, I'll say, we love ile, you want to self-diagnose before you go to the gyna.
Pelvic pain, discharge, menstrual irregularity, or bleeding, and yet it's not your menstrual, you're not expecting your periods and you bleed. Pain and bleeding during or after sex. If you experience any of that, visit your gyna.
Very important.
Yes, very important. Maybe next cycle, I'll be okay. So those are the most common symptoms.
Thank you so much. Asante sana daktari.
Thank you.
We've been educated. I have been educated at least on a few things that I did not know, and those that I would assume also. And I do believe my viewer out there, my sister, my mother, you've been educated on some things, and we are looking forward to having more and more discussions together in Daktari. Daktari is available, and he will be here